Now, the alert from the Surgeon General, shining a light on a leading preventable cause of cancer. We're talking about alcohol. Here's what he told ABC News.
We've seen data now building for years that's telling us that there is a causal link between alcohol and 7 types of cancer, including breast cancer and colorectal cancer. Alcohol is responsible for 100,000 cases of cancer a year in the United States and 20,000 cancer deaths.
The Surgeon General going on to call for a warning label to be added to alcoholic containers. And here to explain more about this is Dr. Elizabeth Comen, a medical oncologist at NYU Langone Health. I know what you feel about this. Is a very strong statement from the Surgeon General. Your thoughts?
So I applaud this statement. You know, most Americans drink, and yet over 50% are not aware that alcohol is actually a carcinogen and one of the leading preventable causes of cancer.
Because we've heard over the years, okay, that if you're a moderate drinker or low amounts were not that detrimental to your health or well-being. This, of course, refutes that. So what does the data say?
Absolutely. We've confused the public, and the data would actually point to the fact that alcohol is a carcinogen and toxic to our cells, which means that it can cause DNA damage, lead to an increased risk of cancer, 7 different cancer types as the Surgeon General referred to, and also a host of other health problems as well. So we really need to be forthcoming with this messaging so that the public is aware that alcohol is simply not safe, and that we encourage patients to talk to their doctors, their family and friends about how they might decrease that consumption.
And as you alluded to, and so did the Surgeon General, 7 cancers in particular are associated with alcohol consumption, including breast cancer. Why is that?
And breast cancer is my specialty.
I know.
So, we know that alcohol is toxic to normal healthy cells and can cause DNA damage. But with breast cancer specifically, it can also affect how our hormones behave. And in many instances, breast cancer is hormonally driven. It can also affect how our healthy cells absorb nutrients that we need. It can also lead to excess weight because it's calories, empty calories. And we know that obesity is also a preventable cause of cancer.
That is true. So what's your guidance here for folks that are tuning in this morning after the first Monday of the new year?
Yeah, and there's been a lot of celebration and sometimes a lot of drinking, and we've normalized drinking around social and cultural norms in our society. So I really encourage patients to talk to their doctor about honestly how much they are drinking, because even a drink a day is associated with an increased risk of cancer and the 7 types of cancers that we talked about.
And I understand you're not a fan of dry January. Why is that?
Well, I mean, I'm always a fan of New Year's resolutions. But my concern about dry January is what happens February 1st. We need to be honest about the lifestyle changes we can realistically make. And if we go cold turkey on something, what happens for the rest of the months of the year? In my field, I see cancer 365 days of the year. And I am focused on how we lead to meaningful, impactful change that relates to patients' healthy lifestyle.
I appreciate your passion and compassion when it comes to this. Thank you so very, very much.
Thank you for having me.
You got it.